Hi, I'm Melissa McDowell, and this is my video case study for my cold laser practitioner certification. This handsome gentleman behind me is McGinty. He is a 20-year-old Tennessee Walker gelding. McGinty was adopted from a local rescue, so his background and history is unknown. What we do know is that McGinty was recently diagnosed with Cushing's, and he's under vet's care and on 1 milligram of Presend a day. Pituitary pars intermediate dysfunction, commonly known as Cushing's, is an endocrine disease that affects the pituitary gland. The most well-known function is the production of adrenocorticotropic hormone, or ACTH, which acts directly on the adrenal glands to stimulate the production of steroids in response to stress. Cushing's is the result of an overproduction of ACTH. My case study is based on a recent study done by Dr. Uwe Peterman called Laser Acupuncture Treatment of Equine Cushing's Syndrome. They studied the effects of laser acupuncture and local laser therapy on more than 30 horses. They reported improvements in all of the animals tested, and they concluded it to be an effective treatment for addressing and lessening the effects of Cushing's in horses. I do want to note there are some differences between that case study and what I am submitting as my case study. In Dr. Peterman's study, they used both laser acupuncture and local laser. I am also a certified MagnaWave practitioner, and I'm using PEMF and local laser. For their case study, they also stopped administering all medicines to the equines in the study to get a very good, accurate reading of the effects of their treatments. So we are not stopping any treatments for McGinty. He is still getting his medicine. And I'm not using laser acupuncture, I'm only using local laser. And we know that Cushing's is not curable, but Deb has acknowledged that while we've been addressing his Cushing's symptoms, they have lessened. He's had fewer outbreaks of laminitis as a result, so we think that's a win. Today I'm going to be using my Domer Class 3 handheld on the lowest frequency in pulse mode and for 30 seconds on each meridian point. It will be done bilaterally. I also want to note that the points that touch the meridians for the horse's organs in Dr. Peterman's study are different from what I'm going to do. I'm using his points, his meridian points, but I'm also adding some based on my research, and I'll let you know about the ones that I add. So we're going to go ahead and turn this on. Let's set it at the lowest setting. Let's set it on pulse. Okay, so I'm first going to start with triple heater 5. Triple heater 5, let's see, the meridian points, sorry, looking at my notes. The meridian points on triple heater are associated with the horse's immune system, and they also relate to thyroid and adrenal glands. And TH5 is the Yang Wei Mai opening point and a thymus acupoint. Nope, front. Sorry, front leg. TH5. Do it for 30 seconds. And I personally prefer this laser because it accounts for my margin of error if I'm not right on the actual meridian point. The radius of the head of my laser will accommodate my inaccuracies. So I do like that. And next, I'm going to move to triple heater 6. Triple heater 6 is a triple heater fire point and a thyroid gland acupoint. Hi, sweet boy. I know, buddy, hang in there. Yeah, bud. From here, I'm going to do governing vessel 14 on his top line, and I'm including this. It was not part of Dr. Peterman's study. I'm adding it to my case study because this is a meeting point of all yang meridians, and the pituitary gland is viewed as being comparatively yang. Okay. From governing vessel 14, I'm going to move to bladder 22. Excuse me, this is also another point that was not included in Dr. Peterman's study, and I'm including this because it's an indicator for endocrine disorders, and it's a triple heater association point. Okay. From bladder 22, I'm going to move down to conception vessel 12. This also was not included in Dr. Peterman's case study, but I'm including it because it is an influential point for all yang organs. And again, we've noted that the pituitary gland is considered to be yang. So conception vessel 12. Oh, I hear gurgling. That's good. Okay. From conception, vessel 12, now I'm going to move into liver and do a couple of liver points. So I'm going to do liver 13 first. Liver 13 is an ACTH and pituitary gland acupoint. Liver points assist in regulation of blood sugar levels, which can be an issue for Cushing's patients. Okay. From there, I'm going to grab my little stool so I can sit down here. Okay. So from liver 13, now I'm going to move to liver 8. This is a liver tonifying point and a liver acupoint. And from this side, I'm going to reach the other side because it's easier. And when I do the other side, I'll reach this leg. 8. Okay. Next, after liver 8, I'm going to do kidney 7. Kidney 7 is a kidney tonifying point and a kidney acupoint. I heard lots of rumbling in your tummy, bud. You're pretty relaxed. From kidney 7, I'm going to move and do kidney 13. Or kidney 3, I'm sorry, kidney 3. And that is a Yuan source point and a master point. Oh, that's a good head lower. Very nice. Okay. Let's scoot a little closer. Okay. There we go. Got a few more seconds on this one, bud. Okay. From kidney 3, I'm going to do kidney 12 or 2. I don't know why I keep saying numbers wrong. Kidney 2 is a kidney fire point, and it's also a reactive acupoint. From kidney 2, then I'm going to move down to liver 3. Liver 3 is a Yuan source point. From liver 3, then I'm going to move down to spleen 2. Spleen 2 is a spleen and pancreas tonifying acupoint. Okay. After spleen 2, then I'm going to go up and do gallbladder 40. Of course, we all know horses don't have gallbladders, but it was a meridian in humans that transferred over to equines. And gallbladder 40 is an opening point for the daimai. that was a good side. Okay, and the last point I'm going to do, excuse me, is stomach 45. This final point also was not included in Dr. Peterman's case study, but I'm including it because it is a Yang Ting point. And then from here, as I said, the points are done bilaterally. I have not done the other side, but I did just film one side for my case study. Thank you.